Hi, welcome back to my channel. Today I bring you a case about carpal tunnel syndrome. In today's case, I'm talking about a 36-year-old female patient who came to the clinic because she was suffering from carpal tunnel syndrome on both her hands. This patient had been a mother 1 month before she came to the clinic, and her carpal tunnel syndrome started showing up during the pregnancy, but gotten worse as she had to take care of her baby. Her main symptoms were pain on both sides, tingling, and numbness. It all started on her right hand, which was the worst of the two, but she had symptoms on both sides. I decided to approach this case with a mixture of techniques, as I usually do. I used the balance method, but I also used scalp acupuncture. In this case, I used Yamamoto New Scalp Acupuncture, YNSA, and Zhu Scalp Acupuncture. I like to work with scalp acupuncture on any kind of case that has neurological type symptoms. This might be numbness, this might be tingling, this might be lack of sensation, and as this patient had all these symptoms, I decided to start with these techniques. If you'd like to learn more about the techniques that I show in my videos, check out the courses I have available. I have Balance Method Acupuncture courses, both in English and in Portuguese, that you can purchase and learn about this technique. On the day of the appointment, the patient was suffering pain on both sides, tingling, and numbness, so all the symptoms were present. I started my approach with Yamamoto New Scalp Acupuncture's point for the hand, and I used it on both sides since she had symptoms on both hands. As soon as I put the needles in, the patient reported that the tingling went down on both sides, the pain went down on both sides, and the numbness changed a little bit, but both hands were still very numb. I was asking the patient to try and feel the fabric on her shirt, and she said that she felt almost nothing. She said that it was almost as if she was wearing thick gloves on her hands. So after this, I went to Zhu Scalp Acupuncture, and I used the upper limb point on both hands. I inserted the needles and I stimulated, as we usually do when applying Zhu Scalp Acupuncture, and the patient reported that the tingling went way down, especially on her left side. There was almost no more tingling, and the pain went down on both sides too. The numbness was still there, but a lot better, especially on her left hand. She was reporting now she could feel differences in the fabric, so the gloves were starting to come off. After that, I decided to continue using the balance method. So, to apply the balance method, as we know, we need to search for an affected channel. Looking at carpal tunnel syndrome, we know that it is mainly in this area. So, which is the main affected channel? Obviously, we have the pericard channel. There are many ways to approach and to balance the pericard channel using the balance method, but since the problem was on both sides, I decided to use system number 2, which allowed me to use only one channel to balance left and right pericard. And according to system 2, we treat pericard using the stomach channel. And to balance this area, I searched for Asha points between stomach 41 and stomach 40. I palpated on both sides, and the side that had more sensitive points was the right side. I needled every acupoint I could find, and the patient reported that the pain went to almost zero on both sides, except for a very particular area on her right hand, which still felt pain. The numbness went down on both sides, and the tingling was almost gone. So I asked the patient to describe to me how was the pain on her right side, and she showed me that she was having pain on this very specific area when moving her hand. Looking at this area, we can determine obviously that the pericord is affected, but we might have some affection also of the lung channel and even, if we think about it, the large intestine channel. So I wanted to use one channel that might balance all three of them. And if you look at your balance method table, you will see that the liver can balance all three of them. So I used liver on her left side. And for this particular area, I searched for points between liver 2 and liver 3. The points were very reactive, meaning very painful when I palpated them, and as soon as I inserted the needles, the pain in this area went away. We stopped the treatment here, and I sent the patient home and saw her again after 7 days. When the patient came back, she reported that her left hand was much better, there was no more pain on the left side, only some tingling and some numbness. And her right hand had less tingling, less numbness, less pain, but they were all still present. So I did exactly the same treatment as the week before, and this time when the patient left, she reported that the left hand was almost normal, meaning no pain, no tingling, and the numbness had gone way down, so a lot more feeling on her left hand. The right hand had no more pain, no more tingling, and the numbness had gone down, but it was still worse than her left side. Again, I saw her for a third time after 7 days, and at this point the patient reported something that was a very emotional moment for me. The patient came back and the first thing she said was, "Oh, I'm so much better. I can finally feel the touch of my baby's skin when I hold her." And this is very gratifying for an acupuncturist or for anyone who likes to help other people, because you can actually see the change you're making on their life. So her left hand was, according to her, pretty much 100%. So no numbness, no tingling, and no pain, and the feeling was almost 100% back. Her right side, there was occasional tingling. There was very rarely some pain, but very light. And it had more feeling, but was still numb compared to the other hand. So on this treatment, I focused more on the right side. I still did the cranial acupuncture points for both sides. So YNSA's hand point and Zhu Scalp Acupuncture upper limb point was done on both sides. But for the balance method, I treated only her right side. So as well as doing left side liver 2 to 3 to treat that area on the hand, I also used the liver on her left side, but now areas 4 to 5 to balance the area of the carpal tunnel. When the patient left, she reported that both hands were 100%. I will still see the patient one more time, but I'm convinced that it will be her last session because all her symptoms will be gone by then. This treatment shows how much acupuncture can help people and shows why it is so important for me to share the message of acupuncture and bring it to as many people as I can. Both so patients can see how acupuncture can help them, and also so acupuncturists can see how using techniques like the balance method or cranial acupuncture can improve your results. This was very gratifying to me. I could really see an improvement in the patient's life, and I hope that you can see how important this is so you can show it to other people. Thank you so much for watching this video. Don't forget to like and subscribe to the channel, and see you next time.